There are 5 medications that could increase your risk of a heart attack. Could the daily medications you're using be unknowingly putting your heart at risk? In this crucial video, we'll uncover 5 common drugs that might be impacting your heart health without your knowledge. Understanding these risks is vital for making informed decisions about your health. If you're committed to safeguarding your well-being, don't forget to subscribe to EverVital and tap the notification bell. This way, you'll stay updated with the latest advice and tips to maintain a strong and healthy heart. 1. Hormonal contraceptives. Hormonal contraceptives have been instrumental in giving women greater control over family planning and reproductive choices. However, their use is associated with varying degrees of cardiovascular risk, making it important to be aware of these concerns when choosing a contraceptive method. Combined hormonal contraceptives, CHCs, which contain both estrogen and progestin, come in various forms, such as pills, patches, and vaginal rings. Research indicates that CHCs can elevate the risk of arterial thrombotic events, such as heart attacks and ischemic strokes. A large-scale study involving over 2 million Danish women aged 15 to 49 revealed that those using estrogen-progestin combination pills had double the risk of these events. This translates to 1 extra stroke for every 4,760 women and 1 additional heart attack per 10,000 women annually. Non-oral CHCs seem to carry even greater risks. For instance, the study found that vaginal rings were associated with a 3.8 times higher risk of heart attacks. The primary concern is estrogen's impact on blood clotting, which increases the likelihood of thrombus formation. Estrogen stimulates the production of clotting factors, making blood more prone to clotting, especially in women with additional risk factors, like smoking, high blood pressure, or high cholesterol. Progestin-only contraceptives, available as pills, injections, implants, or intrauterine devices, IUDs, generally present a lower cardiovascular risk compared to CHCs. The same Danish study showed that, while progestin-only methods had a slightly elevated risk, it was much lower than that of estrogen-containing contraceptives. Notably, the progestin-only IUD did not show an increased risk of heart attacks or strokes, making it a safer option for women concerned about cardiovascular health. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, are commonly used to relieve pain, reduce inflammation, and lower fever. Popular over-the-counter NSAIDs like ibuprofen and naproxen are effective, but they have been linked to an increased risk of cardiovascular events such as heart attacks and strokes. NSAIDs work by blocking cyclooxygenase, COX enzymes, specifically COX-1 and COX-2, which are involved in producing prostaglandins, lipid compounds that play a key role in inflammation and various bodily functions. By inhibiting these enzymes, NSAIDs can disturb the balance between blood vessel constriction and dilation, as well as platelet aggregation, leading to a higher risk of thrombotic events. This is particularly concerning for individuals with pre-existing cardiovascular conditions. Numerous studies have shown the cardiovascular risks associated with NSAID use. The U.S. Food and Drug Administration, FDA, has warned that the risk of heart attack or stroke can begin as early as the first few weeks of NSAID use, with the risk increasing with prolonged use and higher doses. This applies to both over-the-counter and prescription NSAIDs. A comprehensive review in the European Cardiology Review highlighted the overlooked cardiovascular side effects of NSAIDs, leading to greater awareness of these risks. Not all NSAIDs carry the same level of cardiovascular threat. For example, diclofenac has been associated with a higher risk of major cardiovascular events, such as heart attacks, compared to other NSAIDs. On the other hand, naproxen seems to have a relatively lower cardiovascular risk. Given the potential cardiovascular risks, NSAIDs should be used carefully. Before starting NSAID treatment, assess the patient's cardiovascular health and risk factors. Prescribe the lowest effective dose for the shortest duration necessary to relieve symptoms. For long-term NSAID users, regularly monitor blood pressure and check for any heart-related side effects. For those at high cardiovascular risk, consider alternative pain management methods with a lower risk. 3. Thiazolidinedione, diabetes medications, e.g., rosiglitazone. Rosiglitazone, a thiazolidinedione, was developed to help improve blood sugar control in people with type 2 diabetes by increasing insulin sensitivity. However, concerns about its cardiovascular safety have significantly affected its clinical use and regulatory approval. Rosiglitazone works as a peroxisome proliferator activated receptor gamma PPARG agonist, which affects the expression of genes involved in glucose and lipid metabolism, leading to better insulin sensitivity in peripheral tissues. While this mechanism helps lower blood sugar, it can also impact fluid balance and lipid levels, which may have cardiovascular implications. The cardiovascular safety of rosiglitazone has been the subject of significant research and debate. A meta-analysis in the New England Journal of Medicine, 2007, revealed a 43% increase in the risk of heart attacks in patients using rosiglitazone. Several studies have consistently shown that the drug is associated with a higher risk of heart failure. Another comprehensive meta-analysis concluded that although there was no significant increase in heart attacks or overall cardiovascular death, the risk of heart failure was notably higher. Observational studies on the link between rosiglitazone and stroke or all-cause mortality have produced mixed results. Some suggest an increased risk, while others find no significant difference. The ongoing concerns with rosiglitazone highlight the need for careful post-marketing surveillance and a thorough assessment of drug safety profiles. When prescribing thiazolidinediones for diabetes, clinicians must carefully balance the benefits of blood sugar control with potential cardiovascular risks. In patients with existing heart disease or risk factors, alternative medications with safer profiles are often recommended. Certain antidepressants, tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed for depression, but both classes can have cardiovascular side effects that need to be considered when choosing the right medication. TCAs, such as amitriptyline and nortriptyline, work by blocking the reuptake of neurotransmitters, like norepinephrine and serotonin, which helps improve mood. However, their impact on the heart can be significant. TCAs can cause a drop in blood pressure when standing, leading to dizziness and an increased risk of falls. This effect is caused by their action on alpha-adrenergic receptors. Additionally, TCAs can prolong cardiac conduction, resulting in changes on an electrocardiogram, ECG, such as longer PR, QRS, and QT intervals, which can increase the risk of arrhythmias like ventricular tachycardia and fibrillation. Due to their anticholinergic properties, TCAs can also lead to tachycardia, which can be especially concerning in patients with existing heart conditions. As a result, caution is advised when prescribing TCAs to people with cardiovascular diseases, and alternative treatments may be a better option in these cases. SSRIs, such as fluoxetine and sertraline, work by selectively inhibiting serotonin reuptake, leading to mood improvements. Generally, SSRIs are considered to have fewer cardiovascular risks compared to TCAs. However, some SSRIs like citalopram and escitalopram can cause dose-dependent prolongation of the QT interval, which increases the risk of a rare but serious arrhythmia called torsades de pointes. To mitigate this risk, the FDA recommends limiting the maximum daily dose of citalopram. While SSRIs can occasionally cause orthostatic hypotension and bradycardia, these effects are typically mild, but should still be monitored, particularly in patients with existing heart problems. Overall, SSRIs are often the preferred choice for patients with depression and concurrent cardiovascular conditions due to their more favorable side effect profile, though individual risk factors and potential drug interactions should always be considered. 5. Pseudoephedrine. Pseudoephedrine is a common decongestant found in many over-the-counter cold and allergy medications, known for its effectiveness in relieving nasal congestion. However, it can also have cardiovascular effects, particularly in individuals with heart disease. Pseudoephedrine works by stimulating alpha adrenergic receptors, causing blood vessels in the nasal passages to constrict. This reduces swelling and makes breathing easier. However, this vasoconstriction can occur throughout the body, leading to elevated blood pressure and heart rate due to its systemic effects. In patients with controlled hypertension, pseudoephedrine may cause a slight increase in systolic blood pressure. There are also reports connecting its use to acute coronary events, such as heart attacks, as the drug's sympathomimetic effects can raise myocardial oxygen demand, potentially triggering cardiac events, especially in vulnerable individuals. Pseudoephedrine can also cause arrhythmias, including tachycardia or rapid heartbeat. These effects are of particular concern for those with pre-existing heart conditions or those on medications affecting heart rhythm. People with hypertension or arrhythmias should consult their healthcare provider before using medications containing pseudoephedrine. For individuals with cardiovascular concerns, alternative treatments may be recommended. Even healthy individuals should monitor their blood pressure and heart rate when using pseudoephedrine, particularly at higher doses or over extended periods. Additionally, pseudoephedrine can interact with other drugs, such as monoamine oxidase inhibitors, MAOIs, and beta blockers, potentially worsening cardiovascular effects. It's important to inform healthcare providers of all medications being taken to avoid harmful interactions. If you found this video helpful, please give it a thumbs up. Your support allows us to keep bringing you valuable content. We'd love to hear your thoughts, questions, or suggestions for future topics in the comments below. Engaging with you is always a pleasure. Also, don't forget to subscribe and enable notifications so you never miss any of our latest health tips and updates. Stay informed, stay healthy, and we'll see you in the next video.